welcome everybody. My name is Teresa Minette and I work at Sarasota Memorial Hospital. I am a NICU nurse. I'm also a certified breastfeeding consultant and a transport nurse. Thankfully, I've had a lot of experience with breastfeeding and I've really enjoyed it, especially when I know a mom has been able to go home and exclusively breastfeed her infant. Some things I want to go over today about breastfeeding are some of the benefits, like decreased risk of infection, increased bonding with the mom, and also there's actually evidence of higher IQs. What happened is back in about the 1950s, women started going to work and we chose to start giving our babies formula. Now we're the only mammal on the planet that's ever tried this type of experiment, and it was a big failure. What we found out is that breast milk is made specifically for the species that you are trying to feed, so that our natural breast milk is really better for our babies. And we have in the last 5 years made a lot of progress in moving back to that. I'd like to say that as far as immunity is concerned, with the breastfeeding of an infant, you have a decrease in instances of chronic disease, decrease of infections, and a decreased long-term risk of some diseases like diabetes, irritable bowel syndrome, childhood cancers, and asthma. And this is important because some of these are actually deadly and lethal diseases that by breastfeeding your child, you may help prevent. So I've illustrated here on my diagram some of the diseases that you're more likely to get, or your infant is more likely to get if they're exposed and fed primarily formula. Diarrhea, respiratory tract infections, which can cause a child to miss school, which in effect, lowers their chance of gaining education. Otitis media, which is simply an ear infection. Now, these are really painful for infants, and it would be great if we can avoid that, or at least as many that a child might have. Pneumonia, urinary tract infections, necrotizing enterocolitis. Now, NEC is something that is seen primarily in neonatal intensive care units for preterm babies. And we have found that there's a lower incidence of NEC, which means a lower incidence of death of these babies simply because they can digest the breast milk much better than formula. There's a decrease in invasive bacterial infections and diabetes, which so many Americans suffer from today. Celiac disease, inflammatory bowel disorder, childhood cancers, and there's a decrease in asthma, which, as we all know, can be a lifelong problem and restrict the activities of that individual. So what it is that breast milk contains antibodies which help the immune system of the baby develop a little bit sooner than they would naturally with not having any breast milk and with only being given a formula or bottle. So they also, breast milk has some anti-inflammatory agents in it, which we think also decreases some of the inflammation within the body and these autoimmune diseases like the IBS. So, another benefit, a great benefit to breastfeeding is the bonding experience. We know that if a mom breastfeeds her infant, she's holding him close, she has a perfect vision for his eyesight, as opposed to maybe if you're bottle feeding, the bottle can definitely be propped up on a pillow and that child is not getting the same sensory stimulation, either verbally, by touch, and visual, that, that they really need for their best intellectual development. A group in 2013 led by Johnson discovered that babies who are breastfed at least 2 years actually have the best bonding. So that really would be a great goal for parents. The other great aspect of breastfeeding is that we have conclusive evidence that breastfed babies have higher IQs by about 3 to 5 points. So Michelson has done a study and showed that the longer you breastfeed, actually the higher the score increases. So another great reason to go ahead and breastfeed a little bit longer, maybe than the first 6 months or year that is the norm in our country. Worldwide, people tend to breastfeed longer. They breastfeed up till, maybe age 3 to 4. And I think our country is moving along slowly back to that natural way. We know now, we have the evidence that supports it, that the breast is best. It's a natural way to feed our infants. And we also, another study was done, and it shows that babies have better visual acuity when they're breastfed. And we don't know what is the cause. Is it because they're being held closely? Is it just the breast milk? But it's that whole package of a mother being a mom to the baby that helps them grow. In conclusion, I'd like to say and remind everybody that breastfeeding is the natural way. Breast is best, and I hope that you encourage your parents, the patients that you care for, to always choose breastfeeding if they can. So, thank you. Does anybody have any questions?
Is breastfeeding convenient for the working mother?
Oh, absolutely. In this day and age, with all the evidence that we have that supports breastfeeding, the businesses and workplace owners realize that it's a benefit to them to provide moms, working moms, with both a place to to pump their milk for the baby, and also for they have less instance of people calling in sick, because now the babies are healthier drinking the breast milk. So they also, will allow the mom to have a break every few hours to go and pump. So definitely doable. Any other questions?
Do I have to feed my baby more often than a formula-fed baby?
Good question. You may have to, actually, because the breast milk that your body produces is made for your baby. So it's very easily digested. And because of that, the baby may need to eat more frequently, maybe every 2 to 3 hours, as opposed to maybe 3 to 4 for a formula-fed infant, because that's a little harder for the baby to digest, and there's much more of a chance of some constipation. So maybe 1 or 2 more feedings in a 24-hour period, and definitely it is very convenient, because those feedings can happen at night, in your bed, and sitting at the dining room table watching